Hey everyone, welcome to the RightVIEWS podcast. I am Prasanna Naidu.
And I am Rahul Devdar.
And we are going to talk about the second wave going on. Because I tried to find topics and I got three options. One was COVID-19, second was COVID-19, and third, you guessed it right, COVID-19. So let's talk about it. What went wrong? Before starting with that, if you just Google up stuff, you will come to know that most of these cases are in other countries like India is there, US is there, but China there are less cases. Canada, Australia there are less cases. These countries we can understand, but how come China has less cases? Let's start with that. I think that is interesting.
I think uh, China cases, I don't think we can estimate in any way. And the first of all, basically, last year, Wuhan breakout happened in December, and the first cases were reported back in early in or late November and early December, and then the shutdown happened and everything. We are still not sure of the exact number of cases that China had since since the breakout. So any data coming from China, I mean, we should take it with a pinch of salt. And I don't think China is a right example to understand what is going on in terms of COVID. I think a better example in terms of a proper control mechanism or uh, effective tackling of COVID, you can look at is Singapore or you can look at Korea, where the data is at least you have a some sort of confidence on the data. So Singapore basically has managed to control, and Singapore and Korea, even Taiwan as well, they have managed to control COVID using basically at three things: masks, hand sanitizers, and contact tracing. Just three things have helped control the spread of this disease. So that is more sort of a example for India to follow. Now, China really, you can speculate whether it is that they knew the virus so they could treat it properly, but their vaccines don't seem to be working in Chile and all, where they had a breakout despite having high vaccination using Chinese vaccine. So the Chinese vaccine did not was not as effective against COVID. Now, if that is to be believed, then China should also have a breakout. Okay, because China is using Chinese vaccine, and if the Chinese vaccine is not effective, then why is there no breakout in China? Which means which is difficult to explain in many circumstances. It's difficult to explain. So,
but if I remember when the last year when it all started, even though China didn't reveal the exact figures, we had some leaked footage of doctors explaining the current situation. This time we can't see such videos. At least I haven't.
no, there is. They have managed to control the breakout. That is definitely there. So they don't have the breakout. Now the question is why. That is what we don't know. Okay, and secondly, like for example, when we are looking at 2020 videos coming out of China, some of them were propaganda. They were not reliable even then. Okay, like particularly those. I don't know. Did you see the video of people who were walking on the road and suddenly collapsed and died? Have you seen that in back in January? Back in January of 2020, such videos were circulating a lot, where a person is standing in office clothes with his bag and a newspaper, and he suddenly collapses and he's dead. Okay, nobody wants to touch him. So those kinds of things have never happened in any country. So we have now.
Didn't he come alive then? Maybe it was some ad.
That is that may be possible, but at least the video that they were trying to show, this kind of, it created the panic and scare, which resulted in the lockdowns, the first lockdowns. But this kind of situation has never been seen. Like, not even people with severe comorbidities, they, when they were infected, they didn't just stand there and just collapse. So across the rest of the world, I'm saying, in China it has happened. Like, if you see the videos, there are 6 or 7 instances where people are just falling down and just they're dead. And nowhere we have seen this kind of instances anywhere in the world. So those kinds of things make me doubt whether China even did it have any infection at all, or was it just a virus which was sent out of Wuhan and China did not have any virus infection because they shut it down so far, or maybe they had a lot of infections and they are hiding the data. So, like many people, in fact, there are a lot of news reports of immigrant people who have relatives in China, but they are out of China. So they are a resident of US or Europe or these places, who have come out and last year and said that their relatives are missing. They are not able to trace their relatives. So that kind of things are there. So there have been deaths and there have been
But they can't hide it completely now, because we have embassies there.
of course they can hide it. See, that's another thing. What we tend to rely on is basically Twitter and government statistics. If you start going around, roaming around in China, they won't allow you. You're already, you are
Under
followed and you are said
under
basically you
CCTV
don't.
surveillance.
Yeah, so you're already under CCTV surveillance and you're not allowed to move into areas where they just block you, because they block their own citizens. Forget you. I mean, you are nobody. They block their own citizens. So that is the thing. So, in that light, when you look at the infections that have happened across the world, they make more sense because these are proper infections. People do get sick, they go to hospital, they have complications, and there is a rush. And that is all as per, even we have seen this during Spanish flu. So this is a similar event in terms of historical significance, and so we have seen that that is what it is being followed. But the example of China is completely, like, it's an outlier in every aspect. It has not never seen, never happened anywhere else in the world. So in what my suggestion was that if something happens or they claim that has happened in China, at least somewhere you should see that kind of replication.
Right.
So now in India, what we have is a severe variant which is more virulent, uh, with lot of it's called R naught. So R naught in earlier cases was like 1.6 was the estimate. Now it is this particular variant that we have in India. They are saying that it could be as high as 2.4 or something like that. So it is very virulent. So one person is infecting about, you know, 2.5 to 3 people. So earlier it was just 1 or 2 people. Now it is 2 or 3 people. So it is multiplying quickly. So that is the difference in this variant versus the first wave variant.
Yeah, because we all know, like in India, every other person is calling someone to help someone, like with oxygen cylinders or someone. Because every, like, some friend or some relative or even their family members or themselves are going through it, like they are hospitalized or home quarantined or something like that. So things are pretty serious. If we
Actually,
talk about, yeah,
actually, one of the things that you're saying is very relevant, and things are serious. But this is the power of media, and actually the failure of media. We can say that things were serious in first round also. Okay, but the first round dispersion of cases was far wider,
right,
and your means your, mine, the media fellows, our close fellows, our close relatives, they were not affected. Okay. Now it is hitting closer to home in places which are like Mumbai, Delhi, Calcutta, not Calcutta as much, but main cities where the population cannot really socially distance. I mean, in Mumbai local, there is no social distancing. Okay, it's not possible. If one fellow who has COVID enters the local, each compartment has got like 15,000 people standing, I don't know, suspended in that. Okay. So all the 9 compartments, all 15,000 multiplied by 9, all of them are going to get COVID. Okay. There is no escape.
15,000 in one.
Yes. And this is,
Okay.
this is like a good estimate. It might be 20 or 25,000 also. Okay. If you go stand in Kurla, I'm sure it is 25,000. I can't believe it is 15,000.
Yeah.
Like the geometry of human body and the compartment do not match. Okay. So in the compartment, if you fit those many people, they are breathing the same air. Okay.
I remember
My
this.
carbon dioxide is going into your lungs. My virus is, of course, going into your lungs. It is not possible that they are not infected. Everyone should be infected.
Hmm.
And all it takes is like one guy, okay,
Yeah, exactly.
to enter that train. So in Mumbai, if you see on the local train, the violence would be not 2 or 3, it will be like 500. So one guy infecting 500 people, that kind of, so it's super spreader. So these every 2 minutes there's a train. Every train is a super spreader event.
Hmm.
Because there will be one idiot, okay, who has the symptoms and who still boards this. There will always be that one idiot.
And now I don't know about much about it, but it's like it's spreading through air. So
That's what they're saying. Now
that's what
it's
it. And double
airborne.
masking is more effective. So people have started double masking. I don't know how much effective, but even I went outside, so I double masked myself. Let's see.
See, I think double masking and all, I mean, see, beyond a point, you have to realize that if any air molecule can come through, virus can come through.
Yeah.
Okay. Because they are not that big. Virus is not that big. Okay. So if few molecules of air, and it can't be like only one molecule of air is coming, you will not breathe that time. So, one mask, the effectiveness, I don't know, it's 92 or something, 92 or 94%. If you add one more mask, then 92 becomes 95 or 96. If you add third one, that 95, 96 becomes 97. If the fourth one makes it 98. So by that logic, after if you put 10 masks, you will be immortal. But it will be effect that will be zero because you will not be able to breathe.
Yeah.
So I think more than that, everyone wearing a mask. Okay, just one mask properly around the nose, not around the mouth and nose is open.
Hmm.
Okay, because I've seen like this.
Yeah, yeah.
So nose
Yeah,
is
yeah.
open,
Nose is open.
and then people are doing like this, touching everywhere, and then doing.
Actually, this reminds me of my brother. He always tells me about this. He runs a shop. It's a local like kirana type. And just beside his shop, like there's a lane where this COVID test center is the testing center. Okay, RT-PCR test center. So he tells me all those patients or whoever is testing comes to his store to buy anything. And many people come and while talking they remove the mask and ask, "Bhaiya, the COVID center idhar hai kya?" And he's like, what should I tell them? He's coming to ask me about the COVID center and he's opening, like removing the mask and asking me.
I
So
know.
that's it. Okay, so what about other countries like Canada, Israel, Australia? Like some countries we can understand where the population is very less
No, it's a population density is
density.
more relevant.
Hmm.
Okay, so Singapore has less population. It's about 5 million people, 5.5 million people. But That's not much. But the point of Singapore is that the population density is very high. So the area is not much. Now,
Yeah.
if you look at Canada, Canada is one of the largest countries in the world.
Right.
It has 25 million people, which is the size of Maharashtra. People of Maharashtra living in country probably 3 times the size of India. So
Right.
they are anyways, their concept of distancing is already there. So normal distance is only
Uh,
10 feet. So their
yeah.
virus cannot go. So
Mhm.
I mean, it's not like that in towns and cities. It's still concentrated, but you can imagine. So that is the kind of population density we're talking about. In Northern Europe, where uh, Finland, Sweden, Norway, populations are very low. Okay, compared to the size of the country, I'm talking about. Again, so the cities like Sweden or Oslo, they have a density, but it's nowhere close to Singapore or Mumbai is like way ahead. Okay, because even in density calculations, what we calculate is Mumbai, not Thane. Thane is another. So if you look at Mumbai region MMR, the
Yeah.
Mumbai metropolitan region, it's like a state. It's like a country actually.
Yeah.
So Australia also a large continent, some of the few cities, and the rest is quite okay. So in here, the rest of the places don't have as much problem. It's only the cities, and cities also because the population is less and the country cities are spread out. You can have a mechanism where the potential contact is lower. Okay, so
Right.
if I want to ensure that people don't come in contact with each other, it is possible to execute that kind of a strategy in Melbourne or a Sydney as compared to Mumbai. In Mumbai, you can't have that strategy because people are virtually living in each other's laps. Okay, so no matter you say social distancing, it can't be done. The
Exactly.
flat
Also,
flat
the
is only
policy
600.
implementation. The
Hmm.
policy implementation is quite tough. If we try to implement a policy in the country cities which you talked about right now,
Hmm.
the communication is way better there comparatively.
Communication is way better, no doubt. And like for example, their appreciation for what is going on is much higher. And you might say that their media is otherwise anti-India or otherwise, but for their own country, their media is very sensible, not like our media. So, for example, I'll tell you a very simple thing. When we started the first lockdown, why did we start the lockdown? We started the lockdown because the number of cases. So what happens is that any pandemic, if you want to reply to or respond to any pandemic, what we have is public infrastructure. Okay, public health infrastructure, which means you need hospital beds, you need ventilators, you need oxygen cylinders, you need medicines, you need vaccines, and everything. Okay, now if it was a malaria, something we have already tackled. Okay, it's a malaria infection which is spreading very fast. What do you do? So you have malaria medicines which are already available in the market. You stack them up. You say ki malaria, there is a special variant of malaria or whatever is coming out. So this is the medicines. You keep them, oxygen, this, that, and if a patient is there, you bring him here, and then you can treat him. That's how you do it. Now in COVID, what happened was we didn't know the virus. So the medicine to tackle a virus is not easily available. In fact, for many viruses, in fact, all viruses, there's no medicine. So what you have is a prevention, which is basically vaccine. So it prevents you, okay, from getting it. But there is no medicine. So once the virus is attacking you, your body has to defeat it, but there is no medicine to remove the virus. Okay, so the
Right.
medicine is actually to reduce the effects of the virus, or it's basically to reduce your fever, reduce your uncomfortable feeling that you get in COVID's case, to ease your respiration, to make you relaxed. That is the so that your other diseases don't catch up because it's a war going on inside your body where your body is fighting the virus. That is the basic thing. Now, to find a medicine for COVID also it takes time To set up the procedures to accommodate these people also takes time, and the virus is spreading. So to control that, you do a lockdown. So as soon as you have a lockdown, you basically scale up this infrastructure. You scale up the beds, but beds, will they be enough? Just beds? No, you need people who look after the beds, because it's patient bed, it's not hotel bed. So you have to track कि इसको when did you give him which medicine. That charts have to be there. You have to say कि this person is allergic to crocin. You can't give him crocin. You have to give him, I don't know, ampicillin or some, I don't know what they have. But this medicine cannot be given. This fellow is allergic to peanuts. This fellow is allergic to something else. He's got a heart condition, so we might have to act. So all these information needs to be kept ready for the doctor, and this has to be, someone has to fill it in, right? He, Prasanna Naidu is all clear except COVID. So then he can definitely give you whatever medicine he wants. And then somewhere someone else next into your next bed may say ki, he's got so many allergies, I can't give him anything. I have to take him to a ventilator. So you are saved, he's not, you are comfortable, he is not comfortable. Those kinds of things have to be scaled within that lockdown period. What we did not do anything. Everyone sat home, including government officers, saying ki abhi lockdown and nothing will happen. That's not the idea. The idea is to create. So when is the lockdown, you stack up all the medicine, this remdesivir and all this. That time in during first lockdown, people were saying ki hydrochloroquine or something was the best.
Yeah.
So you stack them instead of 100 whatever capsules. You make 100,000 capsules and keep it. Oxygen cylinders, normally you have 10. Now you keep a stock of 500 just because you might need it. Ventilators, you had 10. Now you need 100,000. You order them. That's how it takes. So once that happens and you realize that now, if this today I'm getting 100 patients with my infrastructure, I can handle 5,000 patients. So when you achieve this, then you say, okay, now you can open up 10%, because at this 5% or emergency whatever operation where only groceries are available, basically nothing else is available, right? So in that case, you are getting 100 patients. When you open the next level, like hotels and things, home delivery, then you will get 100, will that 100 infections will go to 200 maybe. Okay, because the more number of people are roaming around, the more the infection spreads. So you say, okay, 100 to 200 I can manage. I can manage up to 5,000. So then I will say, okay, open schools. So how much will that go? Now 200 will become 500. Okay. Now then I say, open some banks, for example, or something like, some of these essential other factories you open for daily goods or something. Then 500 will become 1,000. Okay, now I can handle 1,000. So that's the level of opening I will sustain. Then I will build up more infrastructure. It's not that I will stop building infrastructure. That 1,000 will, now I will take it to 2,500. So once I have that infrastructure, I will say, now open more. Now open cinema halls. Now open large events like marriages, but for smaller people. Okay. So now my infrastructure is up to 50,000 cases. I can handle 50,000 cases per day in Mumbai. Then I'll say, okay, now you can open cinema halls operating at 25% capacity. 100,000. Then I'll say, okay, cinema halls at 50%. What we have done is, the minute the virus started subsiding, this subsides the virus. This helps the virus control the spread. The minute that happened, we said, now we'll have IPL matches. Everyone will be without mask in a stadium. We will be there. We will have big weddings where everyone is talking to everyone without mask. Now nobody is going to have wedding photos in a mask. Have you, can you imagine your husband and wife is standing, or the bride and the groom is standing, and you are meeting them, and everyone is in the mask, and nobody, you can't recognize it. Can be anyone, right? So they will be without mask.
Right.
Once in a lifetime event. And there will be 50 people. 50 people, have you ever seen a compliance of like 100% compliance? 50 people will be there. There'll be 50 servers, okay, people who serve things,
Yeah.
and there'll be 50 guests,
Mm.
and maybe more than 50.
Yeah.
And then they'll be coming and going. So 50 lot will come, 50 will go. So this creates a mass spreading event. And we have been lax in that. And if you look at the next part, in Singapore, day one of this, when second wave started in Europe and US, they started talking about second wave in Singapore. Singapore has not had a case. I mean, it's not had a big breakout of anything. It's like 5 cases, 10 cases. That's all they find. Okay, that too most are imported. So last time they found 39. I said 39. I realized 31 were imported. 7 were local. So this is in spite of this. What they say is ki there is a risk. Let's be alert. Let's have masks. And what they do is they send out in the newspaper in the front page first headline you will see ki, now they are going to police are going to be strict, so there will be an interview with the police or someone, minister of home or something. See ki, I have seen people not wearing masks, so maybe I have asked the police to conduct random raids and catch people who are not wearing masks and fines. Okay, so he is not saying, he is like alerting the people ki now there will be raids, you better comply. Okay. So the second wave has started and these kinds of news have started coming. Okay. People already, and then, next Thursday, Friday, they will put out a news ki 20 people fined for not wearing masks or something.
Mm-hmm.
Okay. Now that 20 people they have caught, but and random raids are being conducted. Naturally, people compliance will improve. In India, what they show kids, look at this wedding, nobody is wearing a mask. This kind of psychologically affects the people. So people are saying if they can't wear a mask, why am I forced to wear a mask? I will also not wear a mask. So that is the effect. And that creates viral infections. So this kind of important communication media has botched up. Only saying ki, accusing this fellow, accusing that fellow, and having single point agenda. Ki, let's attack the government. Our COVID strategy is not right. That is not how you do it. You support the messaging. You say, ki, okay, be at home. If you're not really required to roam around, be at home. So that those who, the essential services guys, there are now essential services. There are essential services, okay. There are people who can't live in the house because they have a fight with their, spouse.
Mm.
There is a one room apartment,
But
they have
but if
one
you
room
say,
apartment.
yeah, that's true in places like Mumbai. But
Yeah.
even those who will have an agenda of always supporting the government, even they are not seen complying with the rules. Like there have been rallies in West Bengal, political rallies. No compliance with
No,
there with any political.
exactly.
Uh-huh.
No, it won't be. I'm saying ki, you can't, I don't know. I'm not saying supporting the government means supporting the party. I'm saying ki supporting anti-COVID effort. That's what I mean. I'm
Hmm.
not saying ki supporting a government as in, BJP. That's not
Right.
what I mean. I'm
Hmm.
saying ki supporting the anti-COVID effort.
Hmm.
So whatever you do, it doesn't matter, political thing. So you spread the word in such a way that compliance increases. I'll tell you a simple example. There is a village of 5,000 people. Okay, there is a party in that village, a marriage party, where 100 people come. 5,000, the village population is 5,000, 100 people marriage party is there. In that 100 people marriage party, nobody is wearing a mask. The 5,000 people in the village are wearing a mask. What will you highlight? If you highlight to the marriage party, look, this entire village, this 5,000 people village is wearing mask. Will the marriage party also wear mask?
Yeah,
Or will you
possibility.
show the villagers, "Ki, look, these 100 people are enjoying without mask." So what will the villagers do? They will stop
Mm.
wearing masks. So this is how have a sensible approach. How many, like, I'm telling you this farmer protest, the laws are completely pro farmers, but yet farmers are protesting. There
No,
is a massage chairs.
there are no farmer. All those
Yeah,
protesting.
whatever, Fortuner farmers.
Yeah.
Fortuner
Okay.
farmers are protesting.
Mm.
Okay. But they have massage chairs,
Mm.
they have biryani, they have
Mm.
foot massagers,
Mm.
they have actually people coming to massage these people, right? Why
Mm.
can't we have similar, if they have such money, why don't they have send these people for massaging doctors? Let's have 10 chairs for doctors so that after serving all these people, they remove their PPE
Mm.
and have a bath, clean themselves, sit on a chair, get massage. They'll also feel happy, right? Why don't you arrange that? This is what I'm saying. Ki this is
Uh,
the kind of messaging creates problems. Okay. And this is happening. People are helping doctors. Okay. Doctors are getting help from private individuals. People are delivering food and all this to these hospitals free of charge. In many cases, I'm not talking about everywhere, but wherever people can. Now, recently, I think couple of days back, someone sold their car and using that money, he's supporting some families for oxygen and all these. People are doing that. Highlight them. Why do you highlight, in this rally, nobody is wearing a mask? Of course, they are stupid. But do you want to make stupid people heroes or you want to make good people heroes? So this is
right.
the basic point. You create a pandemic response template. You create a lockdown to catch up with the virus. And once you have caught up with the virus, it's like a cricket match. You have 300, 400 runs to get in a one day, and you are starting very well, or you are starting slow. Okay, first 5 overs you haven't done anything, and then you get some guy who hits and gets your run rate within six. Now your job is to keep it within six, so that you don't lose the match. Someone has done good work. You have a match within you. The run rate is achievable. Stick with it. Instead, you are busy trying to create politics. So that is what actually pains me a lot, because this second wave would have been controlled much easily if we had enough uh, attention to detail during the first lockdown. And now second lockdown is there, and I'm telling you there will be a third wave. I'm telling you this happened in Spanish flu also. So first thing I did last year was read a book on Spanish flu, and this is exactly what happened. Second wave was the worst. In fact, that should have signaled to us when the second wave comes, we have to be doubly prepared. And
Yeah.
the third wave was mild, but I don't think we can take the third wave lightly. In
Mm.
Spanish flu, the second wave claimed the most number of lives, and it claimed the lives of young people who were going to war, basically, the First World War. So 30 to 45, that range, people died in that second wave.
Yeah, it's
This
true.
is
I mean,
exactly what is happening. I
recently
just heard,
there was a video which went viral of a doctor who was sort of crying while telling people to follow the rules and all, because they are not able to help people. Uh, there are 35-year-old who are on ventilators and they are not able to do anything. People are dying in front of them. So that was a video which went viral. So whatever you are saying, it's actually true.
yeah,
Yeah.
no, and once the virus hits, there is nothing to be done. Okay. So it's a unique situation where small things like hand sanitizers, masks, social distancing, not having a big gathering, having a small function, 5 people rather than having a 50 people party, not celebrating your birthday with, in a
Pool
pub
party.
or something, pool party. These new things have started.
Yeah.
So instead of that, having a small 4 5 people gathering. That kind of things are very small, right?
Yeah.
But the
Even
impact
new
is
trends
huge.
have come. Even new trends have come, like e-party or e-meeting, where they just
Exactly,
have a video
exactly.
call and have, like, even these things can be promoted. And also, like, the main thing is prevention. For example, I went to the hospital today with my father
Mhm.
to take some medicines. He his medicines were over, so we had to refill it. So I made sure that I am double masked. My father is double masked, and my father is 60 above. So I was always there with him to remind him to make the mask proper. It's coming down. Take it up.
Correct, correct, exactly.
Do these things. I was always there with. That's the only thing. We spent around 4 hours in the hospital.
Yeah.
So even people take the precautions, as it's always said that prevention is better than cure. So that's the main thing, right?
No, and here that is exactly. And prevention is very small steps. Okay. It's masks, it's hand sanitizers, it's very small things. But once you don't do that, the impact is huge.
Huge.
Now, lockdown. Lockdown means, you know, the economy will go for a toss for 2 months. There will be a lot of pressure, people sitting at home, schools closed, offices closed, sitting at home doing nothing. People will
And
get irritated.
exactly, there are a lot of other things which impact these, like the mental health,
Psychological
and
issues,
yes,
yeah.
the
And
crime
now,
rate
if
gets
you see,
increasing.
yeah, and if you see the people who are infected, they are isolated because that's how virus is. And many of the people who always lived with loved ones, their husband, children, now they are all alone, and that is creating a psychological, sort of impact. Ki now I'm facing all this tremendous problem. I'm not able to breathe. I have a problem, and I'm alone. I cannot even talk to anyone
Hmm.
because doctors are also busy. Nobody is there to talk. If the cases are low, doctor will talk at least 5 minutes. They say, no, it will be okay. Everyone have the same problem. They get over in 5 days, 2 days. Now you have only 2 days more to go. Then you will in 2 days you will be all right. That gives people hope. Now here doctors are so overwhelmed that they don't have any time to say, anything. They just give you medicine, go away, and nobody is talking to you, and they feel lonely. And that creates another psychological effect on the patients. And that's why that also has an contributing effect on the, you know, people failing to recover as much.
Also, there is stigma. So it happened today morning only with me. So there was a guy standing beside me, and just like we were maintaining distance, but fine. But then he was talking to nurse, that nurse is asking him, why did you test second time? So he said, first time it was not positive, second time it came positive. So I maintained more distance from him. So it happens, and we can't help it. Like, and the other person who
Distance.
experiences this may feel bad about it. I mean, the stigma, but
Can't
we
help
can't
it.
help. Yeah.
Can't help it. Social distancing is something we can't help, and that's what actually is going to affect psychologically. That we'll study this later, but that is substantial problems will be coming out from this experience. All thanks to China.
Small things. Yeah.
I mean, I would like to highlight just one thing that there will be a third wave. Okay, we are not going to escape any third wave. However, if we do small things like
Why
mask,
are you so sure
sanitize,
about it?
because that's how virus. See what happens in a pandemic, and particularly pandemic, it has to be a virus. Okay, something that spreads very fast.
Hmm.
Okay, so virus have that ability to spread fast. Now, virus has two options. It can either mutate into something really aggressive. Okay. Suppose a virus becomes so aggressive that the minute it enters your body, you are dead. Suppose, assuming that is the kind of that virus cannot survive because to survive it needs a host which is spreading the virus, right?
Hmm.
So a very deadly virus doesn't spread. It it kills a lot of people, but the epidemic dies, the pandemic dies.
Hmm.
Okay. So like this is, I think, one of the, I don't recall just now, but there is it had an effect where people died, but there was no mass spread, because it cannot spread because the host itself dies. The most effective spread of a virus is when the virus is totally normal. It doesn't affect you. Like flu spreads everywhere in the world because in 4 days it just goes away. Okay, so you are not concerned about flu. It comes and it goes.
Right.
So that virus is not deadly. So virus try to mutate into that. Okay, and there will always be a coronavirus. Variants will be mild. It will be, you not even feel the symptoms, or maybe it will be like a cold, common cold, rather than a, you know the present variant, which is like, respiratory disease and all this cannot breathe types. So there, it may not spread also.
Mm.
Okay, the thing is, until and unless it mutates into that diluted version, it will spread, it will continue. So the solution is vaccination. Vaccination doesn't eliminate the virus. It just gives you antibodies. So virus is still there. You have the antibodies to fight it. The next time the virus comes, you can fight it. It's not a big deal for your body.
Mm.
So that kind of thing. So vaccination is now, even in vaccination. Okay, there's one other point that I wanted to highlight. Vaccination has been opened from 18 to 45. Okay, people say ki government has to do it. You are completely, I mean, at least I would have gone for 100% vaccinations for those above 50 or 90, whatever, highest maximum percentage of vaccinations above 50 before opening up the limited doses that we have to a healthier population. Now, within 18 to 45 or within 16 to 50, there are people who need a vaccine because they are having respiratory problems, heart problems, or whatever. So you can open it for them. Okay. So you have, and government, in my mind, did a very good job in sharing the vaccine in a step-by-step manner, and the credit has gone to that Aadhaar and based system, which is basically allowing the people to track and allowing the government to track the vaccination progress and not create this haphazard corrupt practice. You know, on the roadside, the same vaccine is available, because I'm telling you, the minute it is open to everyone, the minute it is open to private players, you are going to see the vaccines from the free category taken off by some middlemen and sent into this paid category.
Mm.
This is going to happen, and then what will people will blame the government, which is what everyone wants. These media, they want that only. They want that narratives. Look, in Dharavi you can get a vaccine if you pay 10,000 rupees or 15,000 rupees, but outside it is actually 600 rupees.
Mm.
So how is this? And then they will accuse. And that is what was, I was thinking ki this will happen in the first round of vaccines. When the vaccines come out, there will be a mad rush. People will say ki if you want a vaccine, pay me 2 lakhs, I will give you vaccine. All that thing was eliminated because of this strategic systematic way in which they went about. And most of the vulnerable people have already been offered an option to take the vaccine. They haven't taken is a separate issue, but they have been offered an option to take the vaccine since 1st January or whatever, 1st February. Now this creates, so this process till 1st May has been managed very well. Okay, in my mind,
Mm.
there's no corruption. Ki I can get you a vaccine. That Devendra Fadnavis' son, or
Nephew.
I don't know, his son, nephew, or whoever, he
Who jumped?
somehow got the vaccine.
Yeah,
Now
jumped the
I'm
line.
suspecting, yeah, this is not good.
Yeah.
But apart from that, I'm saying that if you leave aside that case, I at least haven't heard on a mass scale that vaccine supply, which was meant for senior citizens, have been diverted into some shady pockets. Some people contacting you, if you want vaccine, I will give you. It is started in oxygen cylinders. If you want oxygen cylinders, you pay me 2 lakhs, I will give you oxygen cylinder. These kinds of things have started. This is what is the absolute bad management that you can have. That's why it was very critical to have a systematic vaccination program, and it was going well. If people would have followed the mask and things, this would have been a most successful vaccination program. And even now, they have opened it up, but hopefully, I'm just hoping that they follow the protocol and have some mechanism of controlling how. Otherwise, there are many middlemen who will just siphon off these vaccines from elderly and all this
Who have
scheduling, whatever
access
is going.
to the source. Yeah.
So they will take from that and they will channel it, and you will see, Prasanna, do you want vaccine? I have 2 lakh rupees you give me, I will give you vaccine. And there will be just saline solutions. I don't know, it will be just a label on top of something. All sorts of weirdos will come into this,
Yeah. Yeah.
game. And that's why I'm told that they have restricted the public vaccine is only these two, the current Covishield and the Bharat Biotech vaccine. And privately, if you want, you can get other vaccines. So they are keeping it two different so that it's not mixed up, is what I'm saying. But I mean, I'm hearing. But if this is the way they are going to do it systematically, saying "Okay, we want Covishield or Covaxin, then you take the app, register, you will get a date. On that date, you go into that center, get your vaccine, finished. Then 28 days, whatever days later, you will get another message. Ki now you can go take another shot, go take another shot, finish. In quick time, it will be over. This is tremendously, opportunity for corruption. And you know how creative we are with corruption.
Yeah. Okay, then we'll meet you all in the next episode. Till then, bye bye. Please, if you like this episode, do share this episode with your friends and colleagues. And if you want to check out other episodes, you can check it out on YouTube or any other podcast platforms. Thank you.
Thank you.